All right, let's break it open to our panel now. Joining us now is Dr. Ravindra Mehta. He is the Chief of Pulmonology and Critical Care at Apollo Hospitals in Bangalore. Thank you so much for your time. Good morning to you. Dr. Nihar Parikh is with us. He's a pediatrician doctor, director, chairs and child care, Cam's Corner in Mumbai. And we also have Dr. Mandal with us, consultant at the Apollo hospitals. Let me begin with Dr. Mehta. Dr. Mehta, some of the cases that we are hearing as of this moment seem to be those who are vaccinated are not landing up in hospital. That's one. But the sheer rise in numbers as of this moment, if I can just come to that first. The sheer rise, Delhi in a weekly rise has gone 4 times. Mumbai has gone up exponentially as well. What is that telling us? That is this outbreak backed by Omicron? Is this good to consider as of this moment that this spread that is happening is led by Omicron?
Yes, absolutely right. The whole thought process would be that it's either because of the new variant, which has been seen in other parts of the world, or it's the fact that Delta is coming back, or it's the third aspect is that vaccination is winning out in some way or the other. Data worldwide would tell us this is Omicron right now. And understand that whatever numbers you see is just a very, very small tip of the iceberg. First of all, it's going to be tested only in the big metros. Secondly, you're going to be getting a result 7 to 10 days back. Thirdly, the way it's been seen in other countries, it just exponentially goes up. So it's quite likely we're already in the midst of a Omicron surge, and we'll just have to see where it peaks and the aftermath or the actual effects, which will be the main thing to deal with at this point.
All right. Already in midst of an Omicron surge, says Dr. Mehta. Dr. Parikh, your thoughts? Yesterday we had a warning of sorts come out by the WHO. And they actually do not only name Omicron. They say Delta plus Omicron will lead to a massive surge as well. In US, readings are being taken on how Omicron is not the only one. Delta also dominant factor there?
I think... in Mumbai, especially what we've seen over the last 1 week, I think a majority is Omicron, and I would blame it on the travel. People are coming in, people are traveling. Most of our patients who've tested positive, most of the children are positive, and their entire families turned positive overnight because of the travel or exposure to people who have just recently traveled. So, the Omicron, the testing of the genetics of the virus takes time. So I think a larger number, the entire third wave surge, which we are kind of heading into now, is predominantly going to be Omicron. And we just should keep our fingers crossed that the symptoms stay minimum and we ride through this wave with higher immunity.
I see. Dr. Mandal, is that what you're seeing in your patients as well? Most of them with travel history, so it's not a community spread just yet?
It's difficult to say at this moment because, the sequencing takes time, as has been already mentioned by the other panelists. So we really do not know whether it is Omicron or the previous Delta virus, or it's a combination of Delta plus Omicron, which will definitely take time. But what I will prioritize is, irrespective of whether it is because of Omicron or Delta or Delmicron, the basic COVID appropriate behavior should not be forgotten. And from the second wave, we must learn that we should not import virus or infection from the foreign countries like we did in the second wave. And we have to keep our guards on at the international fronts as well.
I'm not sure I follow when you say that we do not import variants. Delta was first discovered here in India, by the way. But I'll come back to you.
Yeah, Delta is definitely the Indian variant, but there were a lot of cases which actually came from the international travel. And by the time we realized that was too late. So it was perhaps easier to contain few people coming from outside countries rather than containing millions of people inside the country. Okay.
We've got Professor and Dr. Divindakumar Singh also with us now from Sharda Hospital in Greater Noida there. Dr. Singh, just take us through your experience of what you're seeing in your hospital as of this moment, people coming up. What sort of symptomatic treatments are you giving as of this moment?
Basically, in last you can say the 2 weeks, we are getting the patient with the similar kind of the symptoms, and we have lost 2 or 3 patients in which we could not make that.
When you say similar symptoms, you mean?
Means which are very similar to the, you can say, the acute respiratory syndrome, which are mimic to to this COVID infection, but we could not make the diagnosis. Probably that may be because of, that most of the laboratories in the diagnostic centers or tertiary care centers, they are using the previous method of diagnosis, means the previous sequencing. Means the whatever results, the positive results we are getting, we are not sure whether this is because of due to this new variant Omicron, which is causing a milder problem, or because of the previous, the Delta one. So this is the scenario. Some undiagnosed patients we have lost. So basically, on the basis of these two things, we on the basis of limited experience about this. The new variant, the Omicron, we say we are,
Yeah,
we are
but
saying
Dr. Singh, these are vaccinated. You mentioned that you lost a patient also who could not be diagnosed in time. I'm just trying to understand from you, were they vaccinated or not vaccinated?
Though there is a lot of data that this new variant as well as the previous variant is invading this, but means the vaccination is not preventing the infection. Though in both these three patients, all three was, you can say one of them was vaccinated with the single dose and another was vaccinated with the 2 doses. Fully vaccinated.
I see. Could you give us more details about this patient, doctor, fully vaccinated? And if I'm hearing you correctly, you lost that patient despite being fully vaccinated to COVID?
Yes.
What age, what comorbidities?
Patient, is there anyone?
What age was this patient and what comorbidities, doctor?
In one patient, one was the diabetic and another was having no comorbidities at all. And the patient presented with a very short history of 2 to 3 days. The respiratory symptoms, patient started to have the cough, fever, then shortness of the breath. Then patient was hospitalized and put on the ventilator. And we have sent the sample for this COVID, but it was found to be negative. Later on, all the support was given, but finally we lost that patient. And we could not make the diagnosis in that case.
Wow. I just want to take a pause over here and say this to everybody who's just been thinking of Omicron as a less severe variant, to everybody who's been thinking, I'm vaccinated, I'm going to go out and party. Nonetheless, I'm not going to restrict myself at the end of the year. Listen in to what Dr. Divindakumar is saying. Go ahead, sir.
Basically, I would like to say that, as I told you, that at this time we are not sure whether this positive result is due to this the Omicron new variant or because of the Delta variant. And we know the Delta variant is quite virulent, means have the ability to cause the severe problem. So this time, maybe or possibly, the Omicron as well as the previous Delta variant causing the problem simultaneously.
Right, I understand you. But Dr. Singh, how many days was this case?
Pardon? How many days?
How many days back did you lose this patient?
One was, I think, 3 days back and the last week.
All right. Dr. Mehta, do you want to weigh in?
Yeah, so I think the whole thing is we don't have an idea right now, Sonal. We actually are seeing most of the demises we have. All of us have these stories, by the way, are mostly Deltas. Double vaccinated, we know that there is vaccine failure to 5%. We know that vaccines don't work and all. We know that comorbidities don't allow responses. I don't think it's a major cause for alarm. What is the cause for alarm is that Omicron is not benign. It is 40 to 50% Delta, which means if Delta took 10 out of 100 down, then 5 out of 100 will still go down. Let's not forget that. We are getting a feel-safe feeling because it is better than Delta. It is not a panacea. It is not a guarantee. It is not something which we can write off. So that message has to go out loud and clear. Mortalities will happen because vaccination is going to help us, but not help us all the way. That everybody knows at this point from worldwide literature.
Right. Dr. Parekh, is everybody as much exposed, or would you say as of this moment, people who got their vaccines right in the beginning, healthcare workers, frontline workers, those above 60 with comorbidities, they continue to be the most vulnerable even against this variant, or is everybody as susceptible?
The Omicron variant is extremely contagious. I would say 4 to 5 times contagious than the Delta. I mean, the virulence of the virus, we don't know yet. Fingers crossed. So far, we've not had major casualties. Even in the Delta wave, peak of the Delta, pediatric patients didn't suffer as much. So I would personally expect lesser affected pediatric population in the Omicron. But like doctor said ahead, it's a combination of Delta and Omicron. So trying to pinpoint that, okay, it's Omicron, let me let down my guard, it's not that dangerous. I think we should forget that and behave like it's the third wave, forget the possibility of the variant being milder and stick to our protocols of social distancing. But this is definitely more infectious, more contagious, and everybody is at risk of getting this new variant.
Everybody is at risk. And Dr. Parekh, if I can also ask you, the new year brings in some cheer, which is for kids at least, that vaccination is going to begin for them. Have you started getting inquiries already? And what is your advice to parents who are now going to play fastest finger first once more time, this time for their teenagers?
Yeah, so everyone's in a bit of a cheer, but what I keep telling them that the COVID per se in pediatrics has never been a deadly disease. So vaccines in adults were a norm. Everyone was rushing to get them because it could cause death in adults. In children, even at the worst case, which was in the second wave, at the peak of the second wave, we did not have that many mortalities and fatalities. So technically now we're going to inject our children against a virus which has never caused death. So I would weigh the pros and cons. I would ask every parent to follow the local social recommendations, the brands given to them by the country, brands suggested, and the timing of the slot of the age groups. Please follow what your country and what your state is declared. Do not be in a rush. Do not try and supersede the line, bypass the system. Don't go abroad, take different vaccines. We're going to do a great job here with keeping in mind that safety is primary importance when we vaccinate our children.
All right, and also consult your doctor. Let's not forget that. Every child is different. Every child's condition is different. Their vaccination charts are different. So please do consult before you go ahead, but do get vaccinated. That's for sure. Thank you all for joining us this morning as we look at an interesting takeaway from this conversation is not just focus on Omicron, but not forget that Delta hasn't gone anywhere either. So this combination of Delta plus Omicron that seems to be currently the reason behind the spread is what we have to really watch out for. Thank you all for your time.